I'm Dr. Jonah Murdock, and I'm a urologist and urologic surgeon specializing in robotic and laparoscopic surgery. This video is for informational purposes. For diagnosis and treatment, any individual should seek a professional caregiver. This video is about oral drugs used to treat erectile dysfunction. Currently, there are 3 drugs which are FDA approved to treat erectile dysfunction: Viagra, Cialis, and Levitra. These drugs are used by many people, and each individual drug may be quite useful for any individual person, but some people respond better to one of the 3 than others. It is not known exactly why that is true. Many times people trial different drugs, one of the 3 and then the others, in order to see which one works best for them. Approximately 30% of people will not respond to any of the 3 drugs appropriately and will need to seek another therapy like injection therapy, vacuum therapy, or surgery. Viagra and Levitra are similar. Generally speaking, the side effects from each are relatively mild. These drugs take 1 hour to begin to work and usually help the erection for roughly 6 hours after you use the medication. Some people have side effects like blue-green vision changes, headache, problems with intestinal upset, or other problems with Viagra, and they don't have it with Levitra, or vice versa. So trying both agents can be of value. Cialis is different than Levitra and Viagra in that it lasts longer and it takes a bit longer for its onset of action. You should wait 1 hour after consuming the drug before attempting sexual activity, and some people can have success up to 36 hours after using the drug. The side effects of Cialis are similar to that of those of Levitra and of Viagra. However, some patients experience the side effect of muscle ache that is more common with Cialis than with the other medications. Otherwise, in addition, some people use Cialis because since it can be given so far prior to sexual activity, they feel that their sexual intimacy is more spontaneous when they're using Cialis. This is another reason why some people utilize the daily Cialis dosing, which can be given either at 5 milligrams or at 2.5 milligrams a day. There's a high and a low dose for the daily Cialis. And if patients find that if they use the drug in the morning regularly, then their intimacy becomes spontaneous whenever it is attempted, and this helps them to feel as though they're not constrained by taking a drug immediately prior to intimacy. For those who fail to have success with one of the 3 drugs, then vacuum therapy exists, which consists of a cylinder that can be used to draw blood into the penis and generate an erection. Some people have much success with this treatment, and others feel as though the erection is artificial feeling or painful. Another therapy is injection therapy, which can be very successful for those who do not respond to other therapies, is successful in about 95% of patients, but has its own side effects. Over time, there can be fibrosis or scars in the area where the injections have been given, and some people have pain after the injections. Surgery involves the insertion of artificial inflatable cylinders. The surgery takes about an hour to an hour and a half and is done usually on an outpatient basis. Men who use the surgical device, generally speaking, are quite happy, and studies have shown that 90 to 95% would recommend this treatment to a friend.